There are new non-surgical options for common gynecological issues, and here to tell us about them is Dr. Burt Webb with Scottsdale Center for Women's Health. Always good to see you, Dr. Webb.
Thank you.
So let's talk a little bit about some of the common things that bother women, starting with fibroids. There are some new non-surgical options for that, right?
Yes, we've been doing them for several years now, but it's really getting perfected. And often a woman will have fibroids, and she's told just to follow them and come back in a year. And the doctors probably don't do ultrasounds. These should be followed. Each year at least, you should, if you have fibroids, they should be followed, and the growth should be evaluated. Otherwise, they get too big, and then it's even harder to treat, or they start causing problems. So if you follow fibroids, then it's much easier to treat. And that's really important for women to know. The other thing is, a lot of doctors will maybe recommend surgery is always a first response. And I think it's really important to get a second opinion and learn, no matter what you're doing, there are a lot of new ideas out there. And I've stopped doing OB, I'm doing just GYN. It's just a whole new world, and it's really exciting in women as well as men's health care. And a perfect example is with fibroids. The last probably 15 years, we've been killing fibroids without doing surgery, and it's never really caught on, but it's extremely effective. The procedure doesn't hurt. It's very short, it's simple. Insurance covers most all of it. It's a great way of approaching it. So I encourage people to get a second opinion.
And I'm sure a much quicker recovery time with something like that, too.
Oh, yeah.
Now, you also help with leaky bladder, and you can treat that non-surgically, too. Tell me about that, how that works.
That's really interesting, but the key thing there is defining what kind of leaky bladder it is.
Okay.
And once you've done that, then you can, there are several things that you can do. The first thing is, for the majority of the leaky bladder cases, physical therapy. It's amazing. You have to go to a special physical therapist. It's not an area that gynecologists or urologists really are very familiar with. Some of them are, but a lot of this leaking problem can be helped just with physical therapy, but they should be evaluated first, and then go see the physical therapist, a pelvic floor physical therapist. That's the key thing. And they can look up Google it and look up pelvic floor physical therapy or pelvic floor dysfunction. And so that's an area that I specialize in. It creates lots of problems for women, not just leaky bladders, but pain, discomfort with periods, with relationships with partners.
Right.
It's amazing the number of women that have discomfort with relations, and they just live with it. They think that that's normal. And all this is related and can be helped with physical therapy, and then sometimes there's some things that I need to do, but I think the key thing is identifying the problem. And it's amazing the number of women, young and old, that have problems down there that just live with it. Their mother had it, a friend has it, and they think they have to live with it.
Right.
And
opening those lines of communication, I think, are a big part of that. Now, I want to touch on hormones, though, too. You also work with bioidentical hormones. Tell me about that and how that works.
Well, so many women, I think, and men don't understand what bioidentical hormones are, but they're hormones that we can give you in different forms, pellets, creams, lozenges, gels, that are the same molecule that your body produces. So it's nothing new, nothing foreign. And women will come in, they're tired, their sex drive is low, their memory is foggy, and they say, oh, it's just because I'm working hard and I've got all these kids and it's busy. No. Come in, get your blood tested, let me look at the values, and I can talk about different options. I'll talk about the safety, the benefits, and I'll talk about the risks.
And you've got an event coming up where people can learn more about these, especially the fibroids and the bladder issues, right?
Yes. So I'm always happy to talk about hormones and other issues, but this will be a great one with Dr. David Wood, who specializes in killing the fibroids, and we'll run through that. We'll show how that's done. It's very simple. It'll be fun, and we'll have some prizes and food and drink.
Great. And so that event is Wednesday, May 17th, 5:30 p.m., and that's up in Scottsdale.
Yes.
All right. And then you just call for a reservation?
Just call. Right. And pretty simple. We're at Raintree in the 101. Right. We'd love to see everyone. So come in and enjoy yourself. It's pretty relaxed, nothing formal. People don't have to be worried about. anything.
All right. Thank you so much, Dr. Webb.
Gina, thank you.
If you'd like more information on Scottsdale Center for Women's Health, visit their website, scottsdalewomenshealth.com, or call the number on your screen.